Is it too soon to talk about, because they're mentioning in the news conference, a third wave?
Absolutely. We are making quite a bit of a headway here for two reasons. Number one, we are finally over the hump from the increase in the numbers in terms of the Christmas holiday and the really strict restrictions that took place in the last few weeks in many provinces here in Canada. However, what the variant in Newfoundland has shown us is that the numbers can go really quickly from a very good control to a really poor control, because primarily the variants are really easy to spread, and that's the danger in terms of the variants. And I think between the lifting of the restrictions, the arrival of the variants in really large numbers, it is not too early to talk about the third wave. Plan for it, to be ahead of it. We know that even though the official numbers are 550 something number of people with variants, we know that the real number is probably in the few thousands, because not everybody who is positive gets tested for the other variants on all the provinces. And so we know we need to understand that the numbers are actually much worse in terms of variants, and therefore we really need to be ahead of the curve. We need to plan aggressively for this third wave, because it's coming and it's just a matter of time.
And on the variants front, there's also reports now of what they're calling homegrown variants popping up in the United States. So to walk us through how important it is to be able to detect that, because as you said, there might be a lot more out there that we don't know about, in terms of how you track it, how you, sequence it, and how much that's going to be needed in the coming weeks.
Absolutely. First of all, variants emerge because there's poor control. And so, for example, in the United States, the one variant that we are now learning about more and more is the LA variant. And if you recall, LA and California in general, but LA specifically, was probably the most worst hit place after New York in the first wave. And so that's the first thing that we need to understand, is that variants are results most of the time of an out of control virus. Now, it is really important to test for it, and I think that here in Canada we really need to become more aggressive in testing in general. I mean, we're talking about 11 months into this, and we still have not used our rapid testing properly. We don't have a very widespread testing like we should. And so it is really important, I think, to increase the number of testing for the variants, so we could plan accordingly, because we know for a fact now that, for example, the UK variant is much more easily spreadable, and that the South African one may not be as responsive to the vaccine. So there are real consequences to these variants beyond just the statistics and the numbers. They're actually very real life consequences to this, and potentially areas that have more South African variant may receive less of a specific vaccine and more of another vaccine. So I think we need immediate increase in testing to all these variants, and in general, just more immediate testing.
Yeah, case in point in Newfoundland, coming back to that again, in terms of the rapid tests, they identified yesterday 7 new cases of COVID and 21 presumptive cases. They were able to do that because of rapid testing. Those people will get a PCR test, of course, after that. So we know that that works. So in light of all of this, what are your thoughts on the slow reopening, or as the Premier in Ontario now calls it, not a reopening as much as it's a transition? Because there's a lot of concern about lifting restrictions and lifting lockdowns because of the variants.
Absolutely. I do have many, and not myself only, but many of the people in the medical community, we have major real issues with the reopening plans, in the sense that a lot of the reopening plans are just primarily nothing but lifting up of restrictions without an actual plan. For example, opening up schools in Peel, in the GTA, in Markham, or opening up restrictions in other places in Quebec should come hand in hand with deployment of rapid testing to these schools, to all these areas where there's large populations. And so the problem with these reopening plans is they're just reopening plans. I think they're just reopening. I think it's a disservice to the word plan to attach it to the word reopening. I mean, there isn't a plan. It's, for the most part, a lot of these provinces are just opening. And what we need to do is we need to have a plan for populated areas, schools, meat plants, a lot of these areas where restrictions are being lifted, there should be rapid testing done. So this way we could control the numbers and bring back contact tracing. Contact tracing is effectively not working right now in Canada because the numbers are out of control. But when you have rapid testing and people are finding out whether they're negative or positive very quickly, then you actually have contact tracing. And we know that contact tracing is important in the process of fighting COVID-19. But if I can't get tested for a few days and if my result is not on for another day, then it is going to be really difficult to track back 5 days ago. Who did I meet? Who did I not meet? Who may have been interacting with me and who did they interact with? So I think increased testing, period, increased rapid testing specifically is extremely needed. And I think that provincial governments and the federal government need to focus on that. Canadians are tired of this, but they're willing to make a sacrifice, but pending that there's a good plan. But unfortunately, what I'm seeing in many different provinces, and Ontario is not alone, is just lifting of restrictions. And I think that's a much more accurate description rather than reopening plans, because I'm not seeing a lot of plans.
Dr. Hassan Masri, great to have you on to talk about this. Thank you.
Thank you so much for having me.